Okay, welcome everybody to our webinar today. This is Lauren Holcomb. I'm the Executive Director for the State Charter Schools Commission. I'm just going to give you all a quick welcome and go through some highlights of some new information that we learned today. And then I'm going to hand this over to Saron Lockett, who is our General Counsel. And just want to thank y'all for gathering here today. We are recording this webinar, so if anybody on your team needs to view this information, or if there are folks just school-wide who weren't able to be here today, we'll have it available. We'll share it out after the webinar. We'll share it with all of our schools for folks who aren't able to be here today. But we just thought it was prudent. There's been a lot of new information coming out very quickly. We know that this is a very stressful season for y'all as you're getting ready to welcome students back in the fall or just put your reentry plans together. So we thought it would be prudent to go through all of this information with you. We want to support you as you gear back up for school and for welcoming students back, whether it's going to be in person, virtually, whatever your plan is. We want to support you. And we also, of course, have an obligation as the oversight body overseeing state charter schools to ensure that all of your plans are aligned with state and federal guidance. We don't want you to start your reentry plans and then come back a few months later and find out that something you're doing isn't allowable. So we're asking all of our schools, Saron, if you want to go ahead and just go to the next slide so I'm not talking before we get there. We're asking schools to submit your reentry plans to us by July 24th. And I just want to reiterate what y'all have already heard from DOE and from state officials is that, we are a local control state, and state charter schools are entitled to make those local control decisions. So you certainly should be preparing a plan that aligns with what the needs of your community are, and you have full flexibility to do that. We just want to make sure, as your oversight body, when you submit those plans to us, we're going to review them and ensure that you're just complying with the same requirements that every other local school system has to align with. So we're going to do a quick review of those and let you know before you get started in the fall if there's anything that needs to be adjusted. And most of you are probably able to join the webinar earlier today with the Governor and Superintendent of Schools and Dr. Toomey, who's the Commissioner at the Georgia Department of Public Health. But we were not planning on that webinar happening earlier today, but it was a fortunate occurrence that it did, because now we're able to give you the highlights of what they reviewed earlier this morning with schools, some new information. As we go through this webinar today, these are the topics we'll be reviewing. And then if you can go on to the next slide, Saron, I want to just highlight a few things that we learned this morning. This is all kind of new information. I wouldn't say that there's anything like groundbreaking that we learned this morning, and I hope that everybody was able to join it. If you're not, we'll give you the highlights of it. But Dr. Toomey answered some questions, and I think everybody received the new restart guidance that came out last Friday, and that's embargoed until 2 p.m. today. So by the time we conclude this webinar, you should be welcome to share that broadly with people in your community. But it just updated, the restart guidance was enhanced and updated some new pieces of information from the Department of Public Health. One big thing from that is that the Department of Public Health will be leading contact tracing initiatives this fall. So it's just important for schools to be aware of that and cooperate with any of those contact tracing efforts that happen. So it sounds like our understanding is that the Georgia Department of Public Health will be leading that. There will be regional offices leading that, but the biggest takeaway for schools from that information is that you really need to be in touch with your local Department of Public Health. Hopefully all of you already are, but if you have not developed a relationship with your Department of Public Health yet, please do so. If you have reported cases of COVID in your school when you welcome students back this fall, you are going to need to be in touch with the local Department of Public Health, and then they are going to contact you. The regional Department of Public Health will contact you so that they can work on that contact tracing. So it's just important that we all be a part of that so that we can mitigate the ongoing spread. And then the next slide, Saron. The biggest takeaway that I got from this webinar this morning is that the governor and the superintendent and the Department of Public Health are all strongly encouraging schools to reopen with a physical presence. Of course, this doesn't apply to our virtual schools who always have an online presence, but if you are a brick and mortar school and you are used to having students in person, they are strongly encouraging that schools all open with an option for a physical brick and mortar presence in the building. The other big takeaway is that they are encouraging the use of masks, but it's not required. And a big piece of that, of course, is that the mask recommendations need to consider student age and students and staff with disabilities. So in some cases, it may not be appropriate for a staff person to wear a mask. Like in the example that they gave is if you have a student that may have a hearing challenge, they may need to be able to see a teacher's lips to be able to read them. We also know it's important maybe for younger populations to be able to see their teacher's lips so that as they're learning phonics. So just consider all of that, but they are strongly encouraging that masks are worn, but they're not mandating that they do it. And then another big takeaway from this in the Department of Public Health guidance that we got is that they're not encouraging people to do testing as a condition of reentry. So there's kind of two components to that. One, they're not encouraging that everybody in the building get retested before they come back into the building this fall. And they're also not encouraging that as you deal with cases from students, if students or staff members who test positive, they're not encouraging that testing be a condition of reentry. So we'll go through this in a little bit more detail, but basically they're just looking at time duration. If you have a positive test, they want somebody to be at home for a certain period of time and not showing symptoms for a period of time, rather than have a negative test, because they think that that's a more reliable indication of transmission and their health. And then there was a question that we just wanted to update y'all on. They asked if students and staff should be screened before they come into the building, like if teachers and staff should be doing temperature checks before people come into the building. And they're really encouraging that instead of doing that at the school level, that you encourage self-screening at the staff and parent level, that parents are screening students with temperature checks every day before they come to school or board the bus. So those are kind of the big highlights. I'm going to hand it off to Saron, and I might pipe in if we have some new things that need to be discussed. But Saron has been going through all of the information that has been available to us. And I know it has been a lot for y'all to go through, and that planning reentry is a lot, and that this is a very, very stressful time. But we are here to support you. We are partners in this work together. And if you have any questions, we're going to keep everybody muted, but please type in your questions into the chat box, and I'll be monitoring that throughout, and we'll certainly hold for questions again at the end. If I missed anything important, I talked about this restart guidance, and the biggest thing, it's not really that there's a lot of changes, it's just incorporating some information that came out of the Department of Public Health into the new restart guidance. So don't feel like it's what they've released is something that's substantively different than what was already released. It's just a few additional pieces of information.
That's correct, Lauren. Can you hear me, Lauren?
Yep.
Okay, perfect. Want to make sure I am unmuted. That's exactly right. There was a lot of guidance that was given this morning. I have tried to organize the rest of this presentation so that it makes clear what's required and what the recommendations are. One of the other things that came out of the meeting this morning was that we are anticipated to have additional restart guidance. The main difference in that guidance as it relates to what was presented before is that there are some enhancements to incorporate Department of Public Health return to school guidance. Again, as Lauren mentioned, they clarified that face coverings are strongly encouraged but not required. And I think the most important difference in the new guidance will be a decision tree. And it essentially is going to, based on confirmed COVID cases and exposures within a school, there are recommended steps to take by both students and staff, and then also schools and school districts. So that'll be very helpful. Again, we expect that guidance will come out in full, probably by the time that we wrap up this meeting. So I haven't gone in detail on it. I want you to be able to actually look at the guidance once it's available to everyone and to work through it. It's a relatively easy kind of picture that kind of, it is a flow chart that kind of flows you through each step that you should take. It's very, very helpful. So rather than try to explain that without the visual, I'm going to hope that comes out at 2, and then ask you guys to just take a look at that and make sure that you use that as guidance.
And I just got it in my inbox, so to the superintendent's list, so it should be going out to everybody pretty quickly. And I'll forward this out to our school list too, because I know sometimes things get caught in filters, and sometimes our schools tend to not get sometimes the information. So I will make sure that all of you have it and that your board chairs have it too.
Perfect. And we will make sure that this presentation and the PowerPoint are available to you, just so that you know any rules, regulations, orders, resolutions that are underlined are hyperlinked for you. So you will be able to access those exact documents while looking through the PowerPoint. Another recent document that came out that we wanted to just cover is the executive order from June 29th. Please keep in mind the effective dates of these executive orders so that you can make sure that you're always keeping abreast of what is recommended and or required of you as the climate changes. The last June 29th executive order is effective from July 1st through the 15th. Generally, it prohibits gatherings, except some exceptions there for schools that are offering summer school services. It does state that schools operating in person shall implement measures, and we'll go over some of those recommended measures. Notably, and we've received some questions about this, so I wanted to definitely pull out that the executive order does not prevent schools from requiring employees to attend in-person activities to support distance learning or other initiatives supportive of school year planning. So keep that in mind. If you are fielding those questions, the executive order may be a good reference point for you as you communicate with employees. Again, as I mentioned, and you can walk through the executive order, here are just a few of the recommendations. Screening for COVID-19 symptoms for employees and students. Again, as Lauren said, this should all be against the backdrop of the more specific guidance that has come out relative to the school environment. As she mentioned before, although the executive order is recommending screening, we just heard this morning that the better recommendation is to try to encourage your students and parents to self-screen at home. Preventative measures include hand washing, hand sanitizing stations, allowing students and staff to take breaks outside where there's a better flow of air and where it's easier to social distance. Having employees with symptoms not report, enhancing sanitization efforts, using signage to encourage hand hygiene, and to really communicate other critical information to your students and your visitors. Community spread. This is one of the topics that we hit. As Lauren already mentioned, it was something that was hit upon in this morning's meeting. Specifically, make sure that you know who your local health department is, know how to contact them and remain in contact. Also, make sure that you're apprised of the changing information that comes from those sites. Make sure you have someone who's available and as a point person to collect that information on a regular basis. There have also been some recommendations that would suggest that you should kind of house all of that information in one area or at one place so that you always know where you can go to find the most current information. If you look at the restart guidance, much of it is tailored towards different risk levels. We are not yet sure what definitions are being applied to those risk levels. We are in communication with the Department of Public Health as well as Godot, and as soon as we have more information about what would be considered a low or moderate or high risk, we'll make sure to get that information to you as soon as possible. For a lot of your schools that serve a number of different localities, make sure that you're keeping in mind how you're going to weigh and measure the information from your local Department of Health in determining what your response should be at any given time.
And if I can just pipe in on that, Saron, my understanding is that there's going to be a common definition for community spread that every local public health department will be using so that we can, compare one area to another. We just don't know exactly what that definition is yet, but it is being worked on. My understanding is that it's supposed to be released very soon, and I got that information last week, so I'm hoping we'll have it this week or next week, and we'll share it out as soon as we can.
Right.
And Saron, we got a question that I think is appropriate to answer now. For statewide attendance zone schools, or schools that serve multiple attendance zones, what do you recommend they do about which local public health department they should contact?
And that's
serving students from different counties or different areas.
Yeah, I don't think that I can answer that from a public health perspective. What I do think you should reach out to your local Department of Public Health, but also consider the specific parameters of your student population. So, if you have one student from one county that is reporting a high risk, you may want to talk to your Department of Public Health about whether that's substantial enough to respond for your entire school community to that specific risk. You can see how that would be different from 50% of your population comes from one county who has been designated as high risk. It's easier to make that decision. So I do think that's something that you need to speak with your Department of Public Health and seek guidance on. It's really a question about health and spread, not necessarily a legal question. So that's my best response. And I certainly don't want to suggest that I know anything about epidemiology or spreads. But, the note here is to make sure of the need to be considering how many locales you serve and to be mindful of your specific student population when assessing how to respond. Lauren, do you have anything to add to that? I am hesitant to talk in an area that I know I'm not qualified to speak in.
Yeah, no, I mean, I just think that the school needs to have a policy about what the plan is. And, in these types of situations, I think it's maybe better to over communicate rather than under communicate. So I personally would probably just contact both, but that's, I'm not the school. The school can make a policy decision about what their communication strategy is on that.
Sure. The guidance that I've read thus far has really stressed letting the Department of Public Health be the guidepost for community spread. And so, to Lauren's point, having a plan is critical, but I think your actions should be guided by Department of Health guidance. For your instructional model, I think we've covered this with many schools just in our informal questions of where can you exercise that broad flexibility and where are you required to follow guidelines. Your instructional model, as you know, although there is a current preference for having some in-person component, you do still, as schools of choice, have the option to poll your school community, to assess your school community's needs, and to design an instructional model that will meet those needs. That can include or exclude in-person reporting schedules. How you track remote and virtual distance learning is something you have a little bit of flexibility in. The Georgia Department of Education just released an attendance and FTE guide that gives quite a few examples of how you might track online or distance learning attendance. Some of those are, you could either track it by assignments that are submitted, you could track it by actually accounting for the duration of time that students are logged in. You could track it based on the amount of time, or attendance based on live instruction models. So the teacher would actually be able to see the students and check them in and out. So there is some flexibility there. Also, there's additional flexibility with your academic calendar. So you can make adjustments as needed, considering your chosen instructional model. The required elements are that you still must report student attendance and FTE. Reporting student attendance for virtual instruction, the Department of Education has suggested or recommended that you keep documentation of how you are accounting for student attendance and distance learning. Modified academic calendars. So as you adjust those academic calendars, you'll need to make sure that any adjustments that occur after May 31st, which would be any here on out, that you provide the Department of Education with notice of those modifications. And then the SCSC has always required that if you're offering primarily virtual or distance instruction, that you ensure that those delivery models are available to all of your students. You can see here, I've linked to the Georgia Department of Education's connectivity and device restart guidance. There's some additional considerations there that you may find helpful if you're moving to a virtual model and that's not your standard model. That's a great resource for restarting in a different model. The SCSC pandemic plans must include a weekly schedule that reflects when and how students, teachers, and staff are required to report. Again, this isn't something that's in rule or in law, but it's something that we've asked that you provide as a part of your pandemic plan. So I felt like that was important enough because we haven't really prescribed the type of plan or how you have to lay it out, but your plan does need to include a weekly schedule to show us how folks are going to be reporting to your school. For purposes of attendance means participating in active instruction and educational service. As I mentioned before, just establish your attendance tracking for methods of virtual instruction. I pointed out again, FTE count is not impacted by your delivery model. You can see the rule that's linked here. It provides just the baseline standard FTE requirements for the dates that it needs to be counted. Again, instructional model does not, there's no exception for this instructional model. You'll still count on the FTE days. Just to point out, this is something that's fairly new. The academic calendar, previously we had been telling schools to make sure that your new or differing schedules were compliant with the academic calendars and other rules for minimum time and attendance. That has now been waived by resolution of the Department of Education. Under Georgia law, the Department of Education can waive or redefine minimum instructional time, calendar year, and calendar day requirements. And so I wanted you to be mindful of that as you're planning out your year. Again, emphasizing FTE reporting obligations remain the same. And just a quick note here, according to the terms of the resolution, the minimum instructional time and other waivers will be granted upon submission of the amended calendar. So just again, underlying the need to make sure that if you're making adjustments to your calendar at this point, that you're providing Godot with notice of those changes. That will then, of course, give you access to these waivers. Processes and procedures. Again, there's a lot of guidance out there. It's linked here. I don't want to necessarily read that to you verbatim. I do want to call out the Georgia's Path to Recovery for K-12 Schools. That's a document that we're referencing that has been updated as I understand it. It covers everything from prevention and response all the way to dealing with vulnerable populations. I'll note there that the vulnerable populations section in that document is limited to the definition for vulnerable populations that are in the executive order. We'll talk just a little bit more about other vulnerable populations like students with disabilities, which I think has only to this point been addressed by the Department of Ed in terms of servicing those students. So I've got some links coming for you in those areas as well. School meals guidance from the working groups is now available, as well as guidance in facilities, equipment, transportation, and as I mentioned before, connectivity devices. We are anticipating that the other three working groups will be forthcoming with guidance as we move closer to reopening. We are definitely recommending that when you submit your pandemic plans that you're doing a thorough review of your policies and your legal requirements. I've got a split screen here. I'm going to walk through some of the requirements of the infectious disease policy, attendance policies that might be relevant to this particular time. And you want to be mindful of your meeting protocols for your students with disabilities, and that you have all your required legal notices available pursuant to law. On the right side of the screen, I've just got a couple of federal laws that might be implicated by this pandemic. You'll want to make sure to be in contact with counsel to ensure that you are in compliance with those laws and that you understand your obligations. I haven't gone into detail about these laws here because how they will impact your student and staff populations is going to be very case specific. So that's something you definitely want to include counsel on as you navigate some of those issues. So infectious disease policy. I've just pulled out the highlights here. Sample policies be provided. We have sample policies that we always provide, or that we provide in connection with monitoring. They do cross many of these levels, so if you have a need or want to review a sample policy that we have available, please reach out to myself or Sarah Beck, our Associate General Counsel. I think she's on here. We'd be happy to give you the sample policies that we've compiled. For infectious disease, your policies you must have a policy regarding the impact of infectious disease. You need to have an annual opportunity for educating your staff on infectious disease. Personal protective equipment must be made available. One question that has come up quite frequently is whether or not you can prevent a student from coming to school in the case of a suspected COVID-19 infection. The current infectious disease rule says that you must immediately counsel persons suspected of infectious disease to obtain a medical evaluation, and that you need to do so in consultation either with a school nurse or local health department. So if you're asking you continuously and repeatedly to stay in contact with your local public health department, keep abreast of Department of Public Health guidance, and that should really provide you a degree of confidence as you communicate with your stakeholders about whether or not it's appropriate to come to school, and whether or not a medical evaluation is recommended. Again, ensure that your decisions are made in conjunction with appropriate health officials and your administrators. This is an existing policy, so nothing has changed here. It's just that you will likely be utilizing this policy in the coming months, hopefully not years, but in the coming months more than you have previously. So you want to be sure that you are in compliance with the requirements. Excused absences. Again, the rule which is highlighted here is linked for you, so you'll have access to this information verbatim. I'm pulling out just a couple of components that might be helpful, particularly as you're encouraging your school community to be mindful of Department of Health regulations. Personal illness or when attendance in school endangers a student's health or the health of others, you're allowed to provide an excused absences under those circumstances. Serious illness, a court order by a government agency mandating absence, or conditions that rendering attendance impossible or hazardous to student health or safety. So there's a lot of flexibility there for you to be able to counsel students that may be on the fence about staying home, that those absences will be excused. You can provide opportunities for makeup work. Those options are available under the excused absences rule. I put out hospital homebound services, which becomes more relevant in the situation where you are having in-person learning. Although it may not be appropriate to have a teacher go to a student's house who may be impacted by COVID-19, if you have in-person instruction, you might be able to offer virtual instruction through hospital homebound services to a student who is in quarantine or is otherwise ill with an infectious disease. So again, this is going to be more relevant to a situation where you have only in-person instruction and you want to provide that virtual instruction to a student who needs to stay home. Vulnerable populations, again, referencing that path to recovery, it is still that still has good information in it. Some of the recommendations include ensuring PPE is readily available, polling those students and staff in vulnerable populations to gauge their interest in returning to traditional work settings, and consulting with counsel to ensure that your policies are in line with law. Lauren and I kind of discussed a little bit earlier that like this is the time to really call on community support, to be flexible, and to try to just think creatively about serving your students and staff in this time.
Yeah, and if I can just add a little bit to that, you know, earlier today we heard the governor and superintendent just strongly encouraging that schools have a physical presence. And, you know, I know that you have the autonomy and authority to decide if that is right for you. And some of you may decide that that's not right for you to reopen with a physical presence, and you may decide to go virtual, and that's certainly within your authority to do that. I just want to encourage all of you, and I know that y'all have already been doing this, but just want to put it on your radar again to really survey your communities and think about what your communities need, because it may be easier for some schools and some communities to transition to a short-term virtual situation than it would be for others. And you know, we don't want to have to put families in a situation where they're having to, you know, prioritize either staying at home so they can supervise children's learning or go to work so that they can feed their children. You know, this is a horrible position for families to be in. So I'm on that supplemental learning committee. One of the recommendations that's going to come out of that committee hopefully soon is just think about partnering maybe in a non-traditional way with your community outfit. So that could be, you know, YMCA or a church or anybody in your community who, there are people in your community who are interested in helping for this challenge. So if you feel like, you know, the facility is just not a feasible option for you, but students need a safe place to be, I just want to encourage you to reach out to those outfits in your community and see if you can find some kind of innovative or non-traditional way to help those families and get through this kind of short-term challenge. And then hopefully next year we can resume back to normal activities. But this is a real opportunity for our schools to kind of showcase how flexible and innovative they can be in meeting their individual community needs.
There is not a that I'm aware of that explains how many absences a school have, but I will look into that, see if there's any additional flexibility for that. I know that there is a rule, but I'm not sure how detailed it is, and I am not aware of any flexibility, but I'm happy to follow up on that and provide that information to you all.
So Ryan, I just got a question asking if schools can mandate masks if the state is not mandating them, and I think the answer to that is yes.
I would say the answer to that is yes. I think the issue, well, the state is not requiring them. I think the question is whether you can be more restrictive than the state. I don't think that you can exclude a student for not wearing a mask. Let me get back to you. Let me think through that. I think the answer to that is yes. However, I'm concerned about a student or family member who might say, you know, my child is required to wear a mask, the state doesn't require it, and preventing that student from access. So let me follow up, let me think that through a little bit more, and I will definitely follow up via email on that. I just want to kind of play it out a little more and just see where the flexibility is there, but I would also say definitely get with your own counsel about setting policies and procedures. We don't want to create barriers to entry, but obviously at this time we are making sure that the safety of our students and staff are, you know, the paramount consideration here. So
yeah, I mean, I have definitely heard of some schools requiring masks, so that doesn't mean that they are allowed to do it, but I know that some schools have that in their reopening plans. So, I mean, not our schools, other school districts are certainly planning on making that a requirement, and businesses are making that a requirement. So, yeah, that's to look into. But
yeah, I definitely just want to give it a little bit more thought to see what the challenge to that might be. I am inclined to say that we can. I'd just like to think it through, just you know, till it's to its logical conclusion, to make sure other things you should be considering when you set those policies.
And so we're making a note of any questions that y'all are asking here that we don't have a definitive answer to, and when we share this out, we'll share out answers to those questions too.
Okay. Again, all of this is in the recommendations for facility considerations are plentiful in much of the guidance that we have. So I've just pulled out a couple broad things specifically for you to be considering as you develop your pandemic plans. First, obviously, your plans need to consider and correspond to all of the community spread levels. You need to be looking to the Department of Health for those, for data for your specific school. not only do you need to assess your needs, but you need to determine what your budget is for implementing a lot of the protocols that you're going to, whether that's PPE, whether it's transitions, whether it's food service, whether it's additional training or providing masks and different types of protective equipment for different staff. Make sure that you're considering not only the need to do it, but budgeting for that implementation. Securing the facility in the event of a temporary closure. I've seen in some of the guidance the recommendations that you turn off water and other services. And so those are just things to consider, again, across every level of spread. How are you going to respond, and make sure that your plans consider each of those things. There is a lot of information and guidance out there about adjusting student and staff transitions in the hallways, as well as I think the most recent guidance even has pictures of ways that you can configure your classroom. That is on the Department of Education's website, and it's going to be included in some of the links there. There's a lot of different, I think they've got some Georgia School Board Association guidance up there, and so there's just a wealth of information about facility related considerations. Again, additional guidance here for meals and transportation resources. This guidance covers everything from in-person serving standards to sending packaged meals home. I do want to point out that our office has been in communication with the department, the nutrition department. We're trying to get some clarification on what or if and under what circumstances our students would be able to access meals similar to the exemption that was implemented this summer that allowed our students to go to some of those county and districts to receive meals. So there's still a question out there about the availability and under what circumstances. So once we have some firm information, we'll make sure to disseminate that as soon as possible. Additionally, there's guidance on disinfecting and cleaning not only your facility, but your school buses, on whether you should consider requiring masks for bus drivers, students on the bus, how to space them if that's at all possible. So make sure that you look out. Again, there's links to each one of these here. Check that guidance as you're developing your plan to just make sure you're considering all possible avenues for flexibility and keeping your students and staff safe. And that covers all the primary areas that I have reviewed in the recent guidance documents that have come out. We are continuing to take a look at any guidance that comes out. Again, some of it I still am kind of screening and vetting and seeing from a legal perspective where those parameters are. So we'll be providing updates specific to questions you asked, but also just any time where guidance might conflict with rules. The guidance is coming from a lot of different places. Most of it's aligned, but as I mentioned, even the Department of Education is using guidance from outside sources. It's available to you, but we're constantly looking through those materials and making sure that it's in line with your charter contracts as well as existing law. A couple of other things I just want to point out is we have taken the position in terms of the flexibility for instructional models that if you're making a temporary adjustment that is not intended to be long-term, that we are not requiring a charter amendment for that. There are some schools I'm aware of that have requirements in the charter contract. Oops, I'm sorry. Calendar requirements. Can you see that? I'm sorry, I had my mouse over the phone number. The phone number is available there. As far as the charter contract, some things, some flexibility may seem in violation of your charter contract. If it is, please give us a call. Please let us take a look and make sure that your flexibility is going to fall within the range that we've allowed in response to the pandemic and that there's not a charter amendment required. In most cases, there's no charter amendment required, but we just want to make sure, just check in with us, get the confirmation. We'll send it via email so that you know that you're operating within the bounds of your charter contract. With that, Lauren, did you have any additional?
No, I don't. I think we've covered everything that we wanted to cover, but I definitely want to give time for anybody to ask questions who wants to ask those. You can type them in the chat box. And then if there's something that we can't answer today, like I said, we will definitely be researching and sharing it back out with you because we want to make sure that we're addressing any questions that you have. And y'all may have been referencing the COVID guidance document that we have on our website. And that has also, as all of this new information has come out, that document has become very cumbersome. So we are streamlining that and trying to make it a little bit more relevant for you to reference as you're reopening this year, just to have all the updated information and strip out some of that outdated stuff. So we'll share that out as soon as it's ready to go too. And I know that there's a ton of information at a ton of different places, but what we're hoping is that that document is one place where you can just get everything in one document. So if you want to get the DOE guidance or CDC guidance, we'll just have all that linked in there for you. So it's one comprehensive document. And, you know, folks had asked about policies, so we can certainly link to some sample policies in there too, if that would be helpful for you.
And I see we've got two more questions at the end here. One is about monitoring documents. If you have a specific need related to the monitoring cycle, you can contact myself or Sarah Beck directly. We're happy to provide flexibility when circumstances warrant, but we're also weighing that in light of, as you notice, there are areas where there's flexibility, and then there's a requirement that you operate within the bounds of the law. And we want to make sure that you're adhering to and that your legal obligations are met. We don't want to push monitoring back too much, because if you have a critical area of non-compliance, that is going to persist longer and in some cases be a lot more, open you up to a lot more risk than you otherwise would have been. So we'd like to correct it earlier than later. Again, if you have specific requests about your school, you can reach out to myself or Sarah Beck. We'll evaluate those, and we'll certainly try to be as flexible as we can as we understand the transitional nature of the time that we're in. The next one was, how do we handle personnel who may not want to return to school? I wonder how accommodating we are required to be. This could be significantly impact our budget. So there are a number of laws, as I mentioned, that there are a number of legal requirements that remain unchanged despite COVID-19. I think Families First Coronavirus Act allows for time off in those situations. You have Section 504 as well as the Americans with Disabilities Act that may be implicated when staff doesn't want to come in. There's also on the Georgia Department of Education, I believe it's linked in the restart guidance, but it's also linked in one of the links here. There's actually guidance on what to do when employees don't want to come to work. Much of it is consistent with the federal laws that I mentioned in this presentation, but again, it also reiterates that it's case specific and that you need to be in contact with counsel about how to address those concerns. Okay. I'm looking in the chat. I think I've captured, those were the last two that I saw.
And then one other thing, maybe just to add onto that question about how to handle personnel, and you know, I realize this may not work in every single situation, but, and y'all probably already thought about this, but you know, you'll probably have some students who aren't comfortable coming back in person, and some staff members who aren't comfortable coming back in person. To the extent that you can kind of match those entities up, and you know, maybe provide a virtual option for folks who just are vulnerable or aren't comfortable, that could work. But I know that the number may be greater than what you're able to accommodate. But that's just one strategy that I've seen some other schools employ that has been successful.
And also, Lauren, that brings to mind one of the things that we recommended or referenced in the guidance document that we sent out when we were requesting the pandemic plans is that you survey or poll both your student and employee populations to see what their comfort level is, and that you consider those concerns as you plan and develop your pandemic plan. That's a way to maybe get in front of that. Maybe you can do some creative assignments so that if you are offering a partially virtual option, that those faculty that are less comfortable coming back may be in the role of a virtual, of providing virtual instruction. But again, I think something that's going to be super instructive there about how you can handle that would be knowing what the needs and desires of your stakeholders are. All right, any other questions? And I am going to, let me see, we've got the website, we've got the address. I will also type in the chat message here. You can contact myself or Sarah Beck directly. I know that she's given you, I think email is probably best while we're in the virtual options, but if you'll check the chat, she's provided both my email and hers for any follow-up or other questions you might have. Also, we can provide you with some sample policies. And
we did get one more question thrown asking, if schools are virtual, can teachers be required to teach remotely from the building?
According to, so I'm going to go back to the executive order, which has, it allows for required attendance at in-person meetings and to plan for the 2020 school year. That is the guidance that is limited in terms of requiring in-person instruction for staff. I do not think that that is outside the scope of that executive order or any existing guidance. What I would say is just make sure that if you want to make those staff comfortable, that you're providing PPE, that you're communicating, over communicating, as Lauren mentioned, any preventative and protective measures that you're requiring. I think that that's fine. I think you have to figure out how you're going to communicate with staff and ease any concerns about them coming into the building. I even saw from a communication standpoint a recommendation that you even video how you're sanitizing and disinfecting your school and disseminating that to staff and to the community as a means of kind of easing any concerns about coming back. Operating well within or above Department of Public Health guidance or CDC guidance may be a way to ease any concerns that staff might have about reporting in person. So those are a couple of things you might want to consider. Any other questions? Okay, well, we will go ahead and end the webinar. I will plan to follow up as soon as possible with some more concrete responses to the questions we received. I think Lauren's got a list. I have a list as well. Please email us if you have any other questions or concerns. We're more than happy to be a support to you as you kind of navigate these really, really interesting times. Paste. Oh, I will put my email into the chat.
Okay, thanks everyone. Just as a reminder, this is recorded and we will send it back out as soon as it's available. It takes an hour or so for it to process sometimes, but as soon as we have a link to the recording, we will send it out to you so you can share it with anybody on your school team who you want to watch.
All right, thank you all very much.
Thanks everyone. Good luck as you make these plans, and please continue to reach out with us if you need anything or have questions.
All right.